Hello everyone and welcome to our module on vascular lesions. Let's start by talking about a blood blister. Many of you have probably had a blood blister. It's caused by traumatic bleeding in the dermis. Remember, the blood vessels in the skin are found in the dermis, not the epidermis, so when there is bleeding, it is going to come from the dermis. And the reason a blister forms is because the epidermis remains intact. So what you get is like what's shown on the screen here, with a collection of blood underneath the intact epidermis. And many of the vascular lesions and vascular tumors we're going to talk about in this video look similar to a blood blister. They're a collection of blood or blood vessels under the skin. So they're not going to be very distinct in terms of how they look. You're going to have to diagnose the condition based on patient characteristics and whether there are single or multiple lesions, because many of these vascular skin lesions look similar. Let's start by talking about angiosarcomas. These are rare tumors that derive from blood or lymph vessels, and they can occur in the skin. So the word sarcoma means a tumor of mesenchyme origin. The mesenchyme is embryonic connective tissue, and the word angio, as you probably know, means blood vessel. So all these tumors derive from endothelial cells of vessels. If they come from the endothelium of a lymph vessel, they are sometimes called a lymph angiosarcoma. If they come from the vascular endothelium, they are sometimes called a hemangiosarcoma. And sometimes benign versions of angiosarcomas form, and these are called hemangiomas. And just like the blood blister, these look like a traditional blood lesion on the skin. They are purple nodules or plaques. And in general, all of these angiosarcomas, which are thankfully rare, have a very poor prognosis. You can imagine that they're highly vascular, it's difficult to perform surgery, and they often metastasize early. Angiosarcomas can occur in the liver, and I talk about these tumors in the GI video on liver tumors. They're associated with environmental exposure to vinyl chloride. They can also occur in the breast. This is often in women who have previously had breast cancer and had radiation therapy, which can damage blood vessel lining. In addition, this often occurs in women who have lymphedema after a mastectomy. That lymphedema can cause lymph vessels to chronically swell, and that can trigger the endothelium to become abnormal, and that can lead to an angiosarcoma of the breast. Angiosarcomas can also occur beneath the skin, and that's why we're talking about these tumors in the dermatology section. And in fact, the skin is the most common location for an angiosarcoma. Usually they occur in the head and neck in areas that are exposed to the sun. The scalp or the face are classic locations. They arrive from the dermis naturally, because the dermis is where your blood vessels are, and they tend to occur in older white males. The median age of diagnosis is 65 to 70, and there's a 2-to-1 male to female ratio. Moving on, let's talk about bacillary angiomatosis. This is a zoonotic infection caused by the bacteria Bartonella, and I talk about this in more detail in the ID section in the video on zoonotic infections. A zoonotic infection is an infection that is transmitted to humans from another species. In the case of Bartonella, it usually comes from lice or cats. There are two types of Bartonella that usually cause infection in humans. The first is Bartonella quintana. The second is Bartonella henselae. And patients who develop bacillary angiomatosis have to be severely immunocompromised. Classically, it occurs in end-stage HIV or AIDS patients. The way this infection develops is that patients who are immunocompromised develop a systemic infection with Bartonella, and this leads to infection of blood vessels in the skin. And as a result, they develop an eruption of numerous red-purple nodules. There's an example of this shown on the screen here. And this can look a lot like Kaposi sarcoma, which also occurs in AIDS patients. So let's talk about Kaposi sarcoma now. Kaposi sarcoma also occurs in end-stage HIV and AIDS. It's caused by the virus HHV8, and this virus causes angioproliferation, especially in the skin, and that leads to a skin rash similar to the rash of bacillary angiomatosis. One of the key differences is on biopsy. So Kaposi sarcoma is a viral infection, so you tend to see lymphocytes. Bacillary angiomatosis is a bacterial infection, so you tend to see neutrophils as well as sometimes lymphocytes. Our next vascular skin lesion is pyogenic granuloma, and the word pyogenic is a misnomer. Pyogenic usually means pus or inflammation, and there is no pus or inflammation involved here. This tumor is also called a lobular capillary hemangioma. This is a benign vascular tumor. It's caused by hyperplasia of blood vessels due to some type of growth stimuli. It most commonly occurs in the skin. That's why we're talking about it in the dermatology section. It can occur in the trunk, arms, legs, head, or neck. It can also occur on the mucosal lining of the lips or gums. This is a picture of someone who has a pyogenic granuloma on the hand. Classically, the growth stimuli that cause this lesion are pregnancy or trauma. So in a board question, this is going to be a pregnant woman who has a blood type skin lesion like this, or someone who's had trauma to a section of their skin and subsequently develops a lesion like this. These lesions often bleed profusely, which is easy to understand because they are caused by hyperplasia of blood vessels and they have to be surgically removed to prevent them from bleeding. A cherry hemangioma is a small red spot. It looks like what's shown on the screen here. It's a benign proliferation of capillaries. This is very common in patients who are middle-aged or elderly. If you have a primary care clinic and you examine the skin of elderly patients, you will usually find some of these lesions, especially on the trunk. They develop with aging. There's usually multiple lesions. They classically occur on the trunk, and they usually are asymptomatic, but sometimes they bleed from trauma. Let's talk about a cystic hygroma. This is a congenital malformation, so it's going to be seen in newborns. It's a large cyst that contains lymph, and it's benign. It's caused by obstruction of lymph drainage in the baby. It classically develops on the neck. So if you look at this newborn on the screen here, the neck appears swollen. That's because the neck contains a cystic hygroma. In the modern era, especially in the US, cystic hygromas are often identified on prenatal ultrasound. They're very easy to see with ultrasound because they are a big black space, like what I've shown on the screen here. These are benign lesions, but the reason they are a cause for concern is that when you detect one on a prenatal ultrasound, you need to be aware that cystic hygromas are associated with a higher risk of fetal aneuploidy or congenital malformations. So many babies that have a cystic hygroma have trisomy 21, which is Down syndrome or Turner syndrome. In addition, many babies who have a cystic hygroma have cardiac or skeletal malformations. There's also an increased risk of miscarriage or fetal death. So if you find a cystic hygroma on ultrasound, that is a high-risk pregnancy. And cystic hygromas are often found together with nuchal translucency, which, as you may know if you've watched our genetics videos, is an indication of possible Down syndrome. Next, let's talk about a glomus tumor. And before we can talk about a glomus tumor, we have to talk about what a glomus body is. So a glomus body is a structure in the dermis of the skin, and glomus bodies are most numerous in your fingers and toes. They contain modified smooth muscle cells, and their role is to regulate skin temperature by shunting blood away from the surface of the skin when it is cold outside, and this preserves body heat. So if you understand that, it's very easy to understand what a glomus tumor is. A glomus tumor is a benign growth of modified smooth muscle cells from the glomus body. These are going to occur in the fingers or toes in the places where you find glomus bodies. Usually glomus tumors occur at the tips or ends of the fingers or toes. Sometimes they are called subungual, which means they are under the nail bed. These present as a pink-purple papule or nodule that's going to be on the fingertips or the tips of the toes or under the nail bed. They are painful, especially when exposed to cold, and that's because the role of the normal glomus body is to constrict in the setting of cold, and these tumors do that, and that leads to pain. These are sometimes described as paroxysms of pain or cold sensitivity. And if you can remember this, it's very easy to recognize these tumors in a board question. A strawberry hemangioma is a benign hemangioma. It's a benign proliferation of blood vessels. These are classically found in newborns. Up to 10% of Caucasian babies in some studies have the presence of a strawberry hemangioma. Usually it's a single lesion, and interestingly, these usually aren't seen at birth, but they're identified in the first few days or months after the baby is born, and they usually go away within a few years. And this is a picture of a strawberry hemangioma on the screen here. And here I've zoomed in on it so you can see that this is the belly button of the baby, and you've got a raised lesion just above the belly button. That is a strawberry hemangioma. It's a benign proliferation of blood vessels. Keeping on the theme of vascular lesions in babies, let's talk about a nevus simplex, which is also called a stork bite or a salmon patch. This is a capillary malformation that occurs in the skin of babies. It's not a tumor, it's a malformation of the capillaries. It's common on the eyelids of babies or the back or nape of the neck. This is a picture of a baby who has a nevus simplex at the back of the neck. You can see this red lesion here, and because it occurs at the back of the neck, that's why it's called a stork bite. This is the classic example of a birthmark or a skin lesion that's present at birth. It's a pink-red macule, just like this one shown on the screen here. It's very common. It's found in up to 60% of newborn babies, and it will fade in the first few years of life and not persist into adulthood. And finally, let's talk about a nevus flammeus, which is usually called a port wine stain. This is also not a tumor, it's a malformation. In this case, it's a malformation of capillaries and venules found in the dermal layer of the skin. As a result of this malformation, there is slow or low blood flow through parts of the skin, and that leads to the presence of pink-red patches on the skin. It's often unilateral, and it's classically on the face, just like shown in this baby here. This is the classic example of a port wine stain on the face. It's a unilateral pink-red patch on one side of the face. It will blanch when pressed, and that's because it's caused by blood flow. So when you press your finger on the skin, you cut off the blood flow and the lesion blanches, which means it turns white. In contrast to the nevus simplex, a nevus flammeus does not regress, and it grows as the child grows. And for that reason, this can be a major cosmetic problem because the child can have the skin lesion on the face throughout his or her life. And in the video on neurocutaneous syndromes, I talk about how a port wine stain is a classic finding in children who have the Sturge-Weber syndrome. Now, most children who have a port wine stain do not have Sturge-Weber, but among children who do have Sturge-Weber, there is often a port wine stain present. And that concludes our video on vascular disorders.